All right, let's talk about the war on cholesterol. But we're not going to cover the part you already know. We are going beyond statins to look at the really powerful, sometimes controversial, and frankly, super high-tech drugs that are completely changing the game.
Look, we've all heard of statins, right? They're the first thing everyone thinks of for lowering cholesterol. But here's the thing. For millions of people, they just don't get the job done. Or maybe the side effects are just too much. So then what? What's plan B? What does the rest of the arsenal even look like? Well, that's exactly what we're going to break down. Okay, so before we jump into the drugs themselves, let's just quickly set the stage. Why do we even care so much about this? Why is the battle against cholesterol so incredibly important? It's because we're facing a very specific and very dangerous enemy.
And that enemy has a name: atherosclerotic cardiovascular disease. Let's just call it ASCVD. This, right here, is the villain of our story. I want you to picture your arteries as these clean, smooth pipes. But over time, cholesterol and other gunk starts to build up, forming these things called plaques. They can clog up the pipes, or worse, they can suddenly burst open, causing a heart attack or a stroke. So remember this: every single drug we're about to talk about has one main mission: defeat ASCVD. So let's get into our first set of tools. These are some of the OG non-statin drugs, the ones doctors turn to for years. You can think of them as the foundational players, the ones that really pave the way for the incredible stuff we have today. First up, we have bile acid sequestrants. The easiest way to think about these is as little sponges that work inside your gut. They soak up these things called bile acids, which, fun fact, your body makes from cholesterol. So your liver has to go, oh, I need more bile acids, and it starts pulling cholesterol out of your blood to make them. And just like that, your LDL, the bad cholesterol, drops by a decent 15 to 30%. But the big downside? Well, they can be pretty rough on your digestive system. And they can act like sponges for other medicines too, soaking them up before your body can, which is a big problem. And then we have niacin. Oh man, this one is a classic story of incredible promise, followed by a huge reality check. For a long time, niacin was a star player. I mean, it seemed to do everything right. It lowered the bad cholesterol, raised the good cholesterol, and some studies even suggested it cut down on heart problems. But then, 2011 happened. The AIM-HIGH trial came out, and the whole story just flipped. They actually stopped the study early because it turned out when you added niacin to a statin, it didn't really prevent any more heart attacks or strokes. And even worse, it might have actually increased the risk of a certain type of stroke. It was a massive plot twist that really threw the whole medical world for a loop. Now, while all this drama was happening with LDL cholesterol, it turns out that's not the only problem. Sometimes, the real issue is a totally different kind of fat floating around in your blood, and that calls for a completely different game plan.
And that brings us to prescription omega-3s. You might think of them as super-strength fish oil. But here's the crucial thing to understand. These are not for lowering your LDL cholesterol. Their one specific job is to go after extremely high triglycerides. We're talking levels way up over 500. It's a perfect example of how treatment has to be laser-focused on the exact problem a patient is having. So, while tackling triglycerides was an important side story, the real earth-shattering revolution was happening back on the LDL front. And this is where we see a massive shift, moving away from these older drugs to therapies that literally target our own genetic code. This is where the science takes a giant leap into the future. And honestly, nothing shows that leap better than this chart. Just look at this. On the left, you've got niacin and the bile acid sequestrants. They lower LDL by, what, 15 to 23%? That's not bad. But then, look at the bar on the right. The PCSK9 inhibitors just storm onto the scene and deliver an average LDL drop of 60%. 60! That's not just a little better, that is a completely different ballgame. So how in the world do they do that? It's actually super clever. So your liver has these little landing pads, or receptors, that snatch LDL cholesterol out of your blood. But there's this protein called PCSK9 that acts like a bad guy, going around and destroying those receptors. Well, these new drugs, they're basically like security guards that hunt down and neutralize PCSK9. With the villain taken care of, your liver is free to put out way more receptors to just vacuum up all that extra cholesterol.
So what does this actually mean for patients? Well, it means a huge, dramatic drop in LDL. We're talking anywhere from 40 to 80%.
These things are literally lifesavers for people with certain genetic conditions or for folks who've already had a heart attack and need to get their numbers super, super low. The one catch? They're not a pill. You have to inject them. And that brings us to the other big catch, the cost. We're talking nearly $6,000 a year. So yeah, this incredible, groundbreaking technology comes with a massive price tag. And that raises some really tough questions about who can actually get access to this science. But what if you could take it even one step further? Instead of just sending out security guards to neutralize the PCSK9 protein, what if you could just tell the factory to stop making it in the first place? Well, that is the mind-blowing idea behind a drug called inclisiran. It's a new kind of therapy called small interfering RNA. You can think of it like a genetic dimmer switch. It sends a message directly to your liver cells that says, hey, stop producing so much of that PCSK9 stuff. It turns down production right at the source.
And the result of this unbelievable technology? It's the dosing schedule. Get this is not a daily pill. It's not a shot you take every 2 weeks. It's an injection just twice a year. Let that sink in, just 2 times a year. For patients, that level of convenience it's just absolutely revolutionary.
And the toolkit just keeps on growing. Now we have all these other highly specialized drugs for very specific, often rare genetic conditions. You've got things like bempedoic acid, which is a pill for people who can't handle statins. And then you have these heavy hitters like lomatepide and evenikimab for people with the absolute most severe forms of genetic high cholesterol. It really shows you we're moving towards a future of much more personalized, targeted medicine.
Okay, so we've got all these amazing, powerful tools. How on earth do doctors decide who gets what? Well, it turns out there's a very clear, evidence-based playbook that they follow.
This table basically shows the 4 main groups of people who really need treatment, and the first step is always a statin. It's people who've already had a heart attack or stroke, people with crazy high cholesterol because of their genes, people with diabetes, and finally, anyone whose risk of a heart event in the next 10 years is calculated to be high. The logic is, if you're in one of these groups and a statin just isn't getting your numbers low enough, that's when doctors start bringing in these powerful non-statin drugs we've been talking about.
And all of this brings us to one final huge question. We've journeyed from these clunky sponges that work in the gut all the way to drugs that can literally go in and silence our genes. The pace of this science is just breathtaking. It really makes you wonder, with these kinds of tools in our hands, are we finally on the verge of conquering one of the biggest killers on the planet? The answer's not here yet, but for the first time, that future feels like it might just be within our reach. Thanks for tuning in.